So if anyone is joining late, please help them out with the page number. So what are inborn errors? They are inherited, genetic. Okay, a child is born with it, born by these errors of metabolism. Okay, certain enzymes are missing in their body, or their body is not able to produce certain enzymes. Okay, so it will affect the way the body breaks down certain foods. Okay, not all enzymes are absent, but some enzymes are absent, which are required to break down some macronutrients. Okay, usually carbohydrates. So when your body cannot break down your macros, carbohydrates or protein, you will not get energy. Okay, that only after breakdown of your macros, food can turn into energy, right? So here, energy production will not be there. On top of that, accumulation of undigested macros will take place in your blood. That will lead to other severe disorders. Okay, so this is what inborn errors of metabolism is. It's rare, genetic, inherited disorders in which your body cannot digest properly. Okay. So these disorders are usually caused by defects in specific proteins that help break down the food. Okay. Uh, Proteins or enzymes. Okay. Any of them that would be defective, or it is completely absent in the body. Okay. The child is not able to produce it. Okay. So how does this get transferred to a child by birth? Both the parents, if they are carrier to certain genetic traits, okay, there are autosomal dominant disorders and autosomal recessive disorders. Okay, autosomal dominant means even if any one of the parent has a genetic capability to transfer a disease condition and the child gets it, it's autosomal dominant. Okay, that trait is dominant. Recessive means only if both the parents are carriers of certain diseases, only then there are chances that the child will have that disease. Okay, so here you can see both the parents. Okay, this black part means the parents have genetic trait of certain diseases, but they themselves don't have the disease. They have the capacity to bring it forth into the next generation. They themselves are not suffering. Okay, when they uh, reproduce, there are four potential chances. Okay, either to have an unaffected child, a child who is children who are carriers of certain diseases. Okay, and another situation is when both the parents are carriers of certain diseases, the child gets that disease, child is born with that disease. Okay, usually autosomal recessive diseases happen like this. So there's a classification of autosomal diseases, inborn errors of metabolism. Okay, protein metabolism, any organic acid, fatty acid, also carbohydrates. Okay, amino acid metabolism, when protein is not able to be digested properly. Okay, that is the phenylketonuria, maple syrup urine disease. These are the examples of it. Organic acid metabolism, glutaric acidemia, propionic acidemia. Okay, all the others. You don't have to learn the names by heart. Just understand there is a classification of inborn errors of metabolism based on what macros are you not able to digest. Is it protein? Is it fat? Is it carbohydrates? Okay, fatty acid metabolism. Fat metabolism does not take place properly. Okay, carnitine uptake defect. Okay, then you have galactosemia, cystic fibrosis, adrenal hyperplasia. Okay, these are other disorders. Then phenylketonuria, PKU disorder. So understanding PKU, it's a genetic disorder in which there is buildup of phenylalanine in the body. Okay. Phenylalanine is has to be broken down. Okay. But when it cannot be broken down, it leads to the buildup of phenylalanine in the body. Okay. So this is a protein. Phenylalanine is an essential amino acid. Okay, if you have gone through the list of essential amino acids, phenylalanine is a essential amino acid that you have to take via food. Okay, even breast milk has phenylalanine. Okay, it's an essential amino acid. So when the body does not have the capacity to produce an enzyme, okay, that can hydrolyze phenylalanine, okay, that's when phenylketonuria takes place. Okay, too much of phenylalanine in the blood, your kidney is also trying its best to take it out of your blood. So that's why in urine there is too much of phenylketones going out of the body. Okay, so that is ketonuria, especially phenylketonuria. Okay, because too much of phenylalanine is in blood, that amount of phenylalanine will leave the body as well. Okay, so it's because of the absence of PAH. Okay, that's the hydrolyzing enzyme. Phenylalanine hydroxylase. Okay, that's a coenzyme. Hydroxylase means that it breaks down the hydrogen oxygen bond in phenylalanine. Okay, so when phenylalanine breaks down in further by phenylalanine hydroxylase, it becomes L-tyrosine, and L-tyrosine is used to produce melanin in your body. Okay, and so forth. So melanin that regulates your sleep, it gives pigment to your skin. That's the function of tyrosine and all. Okay, tyrosine will go and make melanin and all. So that is the another further procedure. But what happens when PAH? This you see here, PAH. That's an enzyme. If PAH is not there, it's absent. Okay, there is nothing to break down phenylalanine. What happens? It becomes phenylpyruvate, acetates, okay, lactates, phenyllactates, and they stay in the body, in the blood. Okay, as it is, it will leave your body. This is an amino acid that is leaving the body. Okay, so that's the disease condition here. Phenylalanine hydroxylase is the enzyme. If that is absent, phenylalanine cannot be broken down. Your body will accumulate phenylalanine. Okay, even through breast milk, the child can become sick. So what are the symptoms? In detail, they have given too much of explanation of this disease condition, but you just have to understand the basic concept of it. Okay. So what are the symptoms of phenylketonuria? Okay, the child is born with small head size. There is a musty odor in the child's breath, skin, or urine. Okay, the child may also undergo mental retardation, some social and behavioral problems. Okay, that because the brain has been affected, personality disorders can also take place. Okay, the child may suffer from frequent seizures, fits, convulsions. Okay, so that's the symptom. Small size head, musty odor, very florally odor in the fruity odor in the child's breath. Okay, it's because of the ketones that is getting accumulated. And also these phenylalanine ketones, since it is too high in the blood, it will affect your brain as well. Brain also gets blood supply. If it is the phenylalanemia, that kind of blood is getting transported to the brain. These phenylketones will also affect it will cause inflammation, and it will cause ill effects to the brain tissue as well. And that's how mental retardation, behavioral problems, personality disorders can develop. Okay, that's, and also the nervous system gets infected. That's why seizures, convulsions, fits will also develop. Occurrence 1 in 10,000 people can get this. Very rare. Okay. In India, it is very rare. Indians usually don't have the risk of developing phenylketonuria, but in Caucasians and Orientals, this is the white race and the Asian race. Okay, Orientals are the Asian race. Okay, they are the ones that can get this disease. It's very rare even in Black Africans, okay, Southeast Asians, Indians. These diseases are very rare, but Caucasians and Orientals, that is whites and European origin, those are Caucasians, and Orientals, Asian origin, are the race that can get phenylketonuria. Okay. Treatment. If treatment is followed, no significant effect on life expectancy. Okay, the child will not uh, die because of phenylketonuria as long as you are following the protocols of disease management. Okay, it's usually dietary changes. You cannot have any protein that has phenylalanine. Okay, so it can also lead to intellectual disability if it is not treated properly, or if you're not following the treatment directions properly. It can lead to intellectual disability, okay, at the first year of life. It can also lead and develop to ADHD. Okay. Treatment. A newborn takes a PKU test. If the test is positive, the newborn parents are instructed to start their infant on a lifelong diet, okay, which restricts the intake of PKU. Lifelong, you can never take phenylalanine based food, okay, because your body does not have the capacity to digest it. So completely avoid phenylalanine based diet. Okay, this specific amino acid in whichever protein based diet it's present, that food source has to be avoided. Okay, and as long as the child is following this PKU free diet, okay, there should not be any symptoms. Okay, the child can have a long life, which is symptom free. Okay, initially, whatever mental retardation this has caused, because if there was a delay in diagnosis, okay, let's say for the first 3 6 months after the child was born, it was not diagnosed. Okay, so whatever damages these ketone bodies may have caused, that may not change. Okay, if brain tissue was affected, nerve center was affected, okay, those changes cannot be reversed too much. Okay, so mild to moderate mental retardation may be there, some behavioral problem, seizures, convulsions may be there, and the child has to take medicines accordingly as well. Okay, so this is about phenylketonuria. Is it clear to all? Then you have galactosemia. So galactosemia, what do you think the word galactosemia means? Can anyone break this word down? What does it mean? Galactosemia. Just from the word, what can you guess? If phenylketonuria is phenylketones in urea, that is urine, too much of phenylketones in urea, or do you think galactosemia would be? Yes, it is related to galactose. Galactose is a form of lactose. which is also a form of glucose. Amia means in blood. So galactosemia means too much of galactose in blood, right? Too much of galactose in blood. And why there is too much of galactose in blood? What would be the reason? Any guesses? Why could be that there is too much of galactose in blood? They cannot break down galactose. Okay, they can break down glucose. Glucose is very easy to break down. That is the final stage of energy, right? Glucose is just a stage before energy. Okay. Galactose has to be broken down further into other forms of lactose and glucose and then be utilized. Okay. So here in galactosemia, galactase, that's an enzyme. Okay. Galactose 1-phosphate or galactase, that's an enzyme that the child's body is not able to produce. Okay. So the child can definitely break down glucose. Okay. The child can also break down fructose. Fructose comes from fruit. That's the sugar that you find in fruits. Okay. Galactose, lactose, it comes from milk. Okay. So ideally, what is recommended here? No milk. Whichever food has lactose, avoid it. So avoid milk. Okay. So this is what galactosemia is. Again, it's an inborn errors of metabolism, in which a specific enzyme called galactase is absent, or the child's body is not producing galactase. Okay. So lactose is that sweetness that you find in milk, lactose. Okay. Lactose is broken down into glucose and galactose. Since lactose is slightly bigger in size, your intestine cannot absorb lactose as it is. Okay, lactose has to be broken down a step further into glucose and galactose. Okay, so glucose will be used up for energy. Okay, but galactose, when a person is normal, there is a GALT. This is a galactose enzyme. Okay, this enzyme will bind to galactose. It will convert galactose into glucose, and then it can be used as energy. This is what happens to a normal person. Okay. So this is what happens to a normal person. But when there is no uh, galt enzyme, okay, galactose phosphate concentration increases because it cannot be converted into glucose. Neither can it be absorbed. Okay, even if it is absorbed, it goes into the bloodstream as it is without being converted into glucose. Okay, and this concentration continuously increases in your blood to very toxic levels that it will lead to kidney failure. Okay, enlarged liver, hepatomegaly, cataract, brain damage, because galactosemia is galactose at a toxic level based blood, and anything that has reached toxic level, wherever this toxic blood is reaching, that area will be damaged. Okay, so your kidneys, liver, eyes, brain, wherever this galactose rich blood is reaching through circulation, all those areas will undergo inflammation. Okay, today's topic is inborn errors of metabolism. So that is galactosemia. So what are the symptoms that you see in a child? Swelling of brain, which is called edema. Okay, pressure around the brain, the child does not want to eat, kidney issues, okay, because it might have, even before diagnosing that the child has galactosemia, damage may have already happened, right? So spitting or vomiting because it is indigestion. Okay, absence of an enzyme means indigestion. There will be spitting up whatever the child has had, milk and all. Okay, breast milk, even breast milk, vomiting it up. Liver failure, jaundice. If liver failure is there, jaundice will come. Anything that happens to any damage that happens to your liver, jaundice will definitely come. Okay, then sepsis, because imagine a situation. Does bacteria require glucose? Does bacteria require glucose? They require glucose, okay, to reproduce, to proliferate, to ferment, okay. Now imagine a situation in which there is too much of this undigested glucose in your blood and you get a small infection in the same time, okay. The baby got a small flu or a small infection and the blood is galactosemic blood. Okay, so a small amount of bacteria can also use up this glucose, this galactose, okay, for its nutrition, and they can multiply and spread and lead to sepsis. Okay, and sepsis, it's not about just one bacteria. On a daily basis, your body is exposed to different types of bacteria. Okay, now this is kind of a big party for the bacteria when you have galactosemia. Okay, so when we say a person is undergoing sepsis, is suffering from sepsis, it's not one isolated infection. Okay, there is more than 2-3 colonies of bacteria that is causing infection. So that is sepsis. Okay, it depends how much it will take to develop sepsis. Also depends on the child's immunity. Okay, how frequently the child was falling ill before, what is the level of the child's immunity, how strong the child is. It's very subjective. That also, your immunity also plays a role in controlling sepsis. Okay, so these are the symptoms of galactosemia. Then we have, how is galactosemia treated? Okay, so the only way to treat galactosemia is through dietary restrictions. From the first day of life, no breastfeeding, and only soya-based formula has to be given. As soon as you get to know the child has galactosemia, even breastfeeding has to be stopped. Okay, and then whatever the doctor has prescribed, what formula based feeding has to be continued, whatever the doctor has prescribed, you have to start that. Okay, soya based formula and all. Okay, the newborn baby with questionable results on newborn screening, the child will have to be treated with soya based products. Okay, don't continue breastfeeding till you get your results. Okay, don't think that, okay, we have given the results of child's blood sample and all for test. Okay, till we get the results, we'll continue breastfeeding. Don't do that. If you think that there is a chance that the child may be galactosemic, immediately stop breastfeeding or any lactose based formula. Immediately stop it and switch to soy based formula. Okay, non lactose formula. Okay, because by the time you are waiting for the diagnosis, you may have caused more damage to the child by continuing breastfeeding. Okay, so if you have any questionable symptoms that you see, okay, and you doubt that this could be galactosemia, immediately stop milk based food and start soy based formula. Okay, and for lifelong this has to be continued. Okay, no galactose based food at all. Is it clear to all what is galactosemia, how it is treated? So next is fructosemia. Okay. Fructosemia. Okay, everything, both will happen together. Only when you have fructosemia, only then you will have fructosuria. Until and unless everything is normal in your blood, your kidneys don't have to worry much. When there is something abnormally high in your blood, that's when your kidneys will start to filter those high levels, those toxic levels out through your urine, and your urine will have that toxic levels of the causative agent. Okay. So fructosuria. Am I audible to all? Am I clear? Am I audible to all? Is my voice breaking? Okay. So fructosuria, this is also another inborn error of fructose metabolism. Here comes fruits. Okay, so far we have seen lactose based metabolism issues. Okay, now it is fructose based. Fructose is from fruits. Fructose is the glucose that you get from fruits. Okay, because there is an enzyme called fructokinase in liver. Okay, that enzyme is absent. The child's body is not able to produce fructokinase. Okay, so fructose will not get converted into glucose. Everything, see, lactose, galactose, fructose, they all have to convert themselves to glucose. Only then your cells can use it. Your cells cannot use lactose for energy. Lactose as it is, okay, galactose as it is, fructose as it is, your cells cannot use. Your cells will not understand the language of galactose, lactose, fructose. Okay, it has to be further broken down to glucose. Glucose is the only language your cells can understand. Glucose is the only one of the macros that, apart from fatty acids, okay, your cells can use up for energy, break down for energy, okay, or burn to for energy. So when fructose cannot get converted into glucose, it will remain high in your blood, causing fructosemia. Okay, and since it is there is too much of fructose in blood, your kidneys are trying to bring back the balance by excreting that excess amount of fructose, causing fructoseuria. Okay, semia is in blood, urea is through urine. Okay, it's usually a harmless condition. Not much severe uh, side effects are seen here as compared to phenylketonuria and galactosemia. Compared to those two situations, this is not that disastrous. Okay, but still, it is still subjective. Okay, it's better to avoid the uh, uh, to avoid having fruits or too ripe fruits and all. You can avoid having some level of ripeness. If there are, if fruits are ripe to a certain level, not completely, then it is fine, they can still have. But completely too sweet and too ripe fruits like extremely sweet oranges, grapes, mangoes, okay, those things you have to avoid. So in normal fructose metabolism, your fructose, okay, it is converted into fructose 1 phosphate. Phosphate and phosphate is taken up for energy formation as well. Okay, and it will further form glyceraldehydes and other dihydroxyacetone phosphate used for different biochemical chemical reactions in your body. Okay, but if you have some intolerance, fructose intolerance, okay, or does not have fructokinase enzyme, okay, it will get accumulated. Fructose 1 phosphate, okay, that will get accumulated in your body, and that could cause toxic effects to your liver, kidney, small intestine. Usually it is harmless, okay, but continuous continuous exposure to fructose and not having the enzyme fructokinase can lead to toxic effects. And these toxic levels can cause harm to your liver, kidneys, and small intestine. It can also cause hypoglycemia because when too much of fructose is there in your blood, conversion of glucose to glycogen, okay, and conversion of glycogen to back to glucose, these conversions will be interrupted. Fructose will not allow these conversion. Okay, so your blood will also not have enough amount of glucose. Okay, your blood has too much of fructose, but it does not have glucose. Glucose is what actually your cells require. Okay, and that is going down. The thing that your cells cannot understand, cannot use, that is fructose, that is going high and high. Okay, so it's an extreme imbalance that is taking place here. So that is fructoseuria. Is it clear to all? Next is fructose 1,6 biphosphatase deficiency. What do you think is this biphosphatase? Any idea what do you think this biphosphatase is? It's an enzyme. Okay, it's an enzyme that is supposed to break down something. Okay, it's an enzyme. So if you see the previous slide, see till fructose 1-phosphate, fructose, you eat your fruits. Okay, fruits will enter your intestine in the form of fructose. Your intestine will take up fructose. Okay, some chemical reaction will go on in which a phosphate ion is added to this fructose on the first carbon. Fructose is it's a glucose. Okay, it's a carbohydrate. It has a chain of carbon ions. Okay, on the first carbon in that chain, one phosphate ion is added. Okay, and that's what goes into your blood. And from the blood, it goes to different parts of your body, usually to the liver, to be stored. Okay, to be converted to something and then stored, to be stored. Okay, so like that, fructose, in fructose, when the phosphate ion is added to the sixth carbon. Okay, remember, it's a carbohydrate. At the end of the day, fructose is also a carbohydrate. Okay, a long chain of carbons are there along with hydrogen, carbohydrate. Okay, so on the sixth carbon, you have the phosphate ion. Just like in the previous slide we have seen on the first carbon there is a phosphate ion. Okay, so now they have reached the liver. Fructose 6-phosphate has reached the liver. In the liver, there is this enzyme called phosphofructokinase. Okay, phosphofructokinase. Okay, again, what is this phospho? The word which is given here, what is this phospho? What ion is it? What do you think is this phospho? It's phosphate ion. Okay, already one phosphate ion along with fructose is coming to the liver. And liver has this enzyme which is phosphofructokinase. Okay, already on the 6th position, a phosphate attached fructose is coming, and the liver has this enzyme phosphofructokinase. When they react with each other, when this enzyme comes to fructose, the enzyme will deposit its own phosphate to this fructose. Okay, so on the first carbon of fructose will get this additional phosphate. Okay, so now there are two phosphates. It originally came with one phosphate, and after reacting with the enzyme, it got another phosphate as well. Okay, so that is fructose 1,6 biphosphate. Okay, now this fructose 1,6 biphosphate will stay in your body. Okay, in your liver. Okay, this fructose 1,6 biphosphate will be stored in your liver. Whenever your body is in requirement of energy, okay, in a normal human being, this fructose 1,6 biphosphate has to leave the liver, get broken down, and give energy. Okay, be converted into glucose and give energy. That is what should take place ideally. Okay, but what is this deficiency? Fructose 1,6 biphosphatase deficiency. What is this deficiency? What is absent here? In this disease condition, what is absent? This enzyme, phosphatase enzyme, not any phosphatase enzyme. Okay, not any phosphatase enzyme, especially the fructose 1,6 biphosphatase enzyme is absent. Okay, do you think the absence of fructose 1,6 biphosphatase will change the structure of fructose 6 phosphate? No, it cannot. Okay, enzymes have particular targets to work on. Okay, enzymes have particular targets to work on. They will not interfere with anything else. Okay, so enzymes are made in such a way, the enzymes that are supposed to break down protein like pepsin, they will break down only protein. Okay, they are not worried about fats and carbohydrates. Enzymes that are supposed to break down fats like your bile salts, okay, they are only worried about the fats. They are not interfering much with carbohydrates or proteins. Okay, it's the same way. Fructose 1,6 biphosphate will, the absence of it will not interfere with any other function, but only with one particular function. And what is that? To convert fructose 1,6 biphosphate back into its original form so that your body can utilize it. Okay, this will go and bind up with some other glycogen molecule to form glucose and give energy. Okay, and also the phosphate ion is breaking off. Always remember, whenever a phosphate ion breaks off, energy is produced. Whenever phosphate breaks off, like in ATP, adenosine triphosphate, okay, 3 phosphates are there. When just one phosphate breaks off and it becomes adenosine diphosphate, energy is produced. Whenever the phosphate bond is broken, energy is produced. Okay, so specifically the absence of this enzyme is a inborn error of metabolism. This red circle you see, fructose 1,6 biphosphatase deficiency. Okay, there is not enough fructose 1,6 biphosphatase in the human body to convert fructose biphosphate into fructose 6. So too much of what happens is that liver has fructose, liver has a storage of fructose. It is increasing and increasing day by day because liver knows how to store it. but liver does not know how to release it when it is required. Okay, and slowly, if a person who has this deficiency, if they consume fruits on a very regular basis, or use cane sugar, honey, high fructose level, maple syrups, okay, if these kind of food items are used on a daily basis, they will suffer from liver issues, because the liver is continuously storing all this fructose, but the liver does not know how to get rid of it, how to release it, because the enzyme that is supposed to help it really help the liver release this fructose is absent. Okay, so that is fructose 1,6 biphosphate deficiency. Is it clear to all? They can use, these people, they can completely use glucose. They can use glucose polymers also. They don't have to be too strict with their diet. Small amount of fruits are still allowed because it's a deficiency. They may have some levels of this enzyme, but not to the normal level. Okay. They can still enjoy some level of some degree of fruits, not too ripe fruits. Okay. The more ripe the fruit gets ripened, more amount of fructose will be there. Okay. So avoid cane sugar, honey, high fructose fruits, and they will usually not like sweet foods much. Okay, so these are the symptoms seen here. Is it clear to all? If you can understand the carbon structure of structure, you will know why these names come into existence. Okay, earlier it just had one phosphate. When it got two phosphate because of this enzymatic reaction, enzyme gave its own phosphate. Okay, it became biphosphate. Pi means two. Fructose 1,6 on the first carbon, and the sixth carbon it got its phosphate ion. Okay. Completely you can avoid fructose. Okay, and its related sugars, and avoid fasting, long periods of fasting. You have to avoid it because you will become hypoglycemic otherwise. Then you have Menkes disease. It's because of uh, high level copper that is not getting absorbed. Okay, deficiency of copper, very rare, because usually everyone some or the other way you get enough amount of copper through pulses and cereals. Okay, but in Menkes disease, you may be getting enough amount of copper, but you are not able to absorb it. Okay, your intestine is not able to absorb it. Whatever copper you're getting through your food, dietary copper, that is leaving your body as it is without being absorbed properly. Okay, it could be a malabsorption syndrome or diseases. Okay, and copper is required for your brain health, skin, hair, bones, your bone marrow to produce red blood cells. Okay, copper is required. So in Menkes disease, these are the uh, signs and symptoms which you can see. The child will have this kinky hair, sparse kinky hair, and that is not that dark. Okay, lack of color in that hair. Okay, very less hair here and there, and that is kinky. Kinky means bent. It's not curly. Okay, kinky hairs are not like curly. The curls are different and kinks are different. Okay, when you draw a zigzag line, okay, and a spiral line, you can understand what is the difference between zigzag and spiral. Zigzag is kinky hair. Okay, a straight hair, that is hair strands are supposed to straighten out when they are pulled. But if they have that zigzagness in them, in that texture, that is kinky hair. Okay. Loss of developmental milestone, truncal hypotonia, muscle tone is not there. Failure to thrive, that is failure to develop according to age. Okay, not able to reach their milestones. They are not able to develop properly. That is failure to thrive. Epilepsy, okay, convulsions. And when you do the lab reports for them, low serum copper levels, low serum celluloplasmin levels, treatment, uh, supplements are available. Copper chloride supplements can be given, and reduce the amount of zinc. If there is too much of zinc in the diet, copper absorption will not take place. Okay, because copper and zinc, they fight with each other for absorption. Okay, they don't allow each other's absorption. So if there is too much of zinc in the diet, reduce zinc rich food. Okay, and copper chloride medication can be given. L-histidine injections can be given. Stop consuming zinc supplements if you are on zinc supplements. Okay, this is Menkes disease. Is it clear to all? Then you have Wilson's disease. It's just the opposite of Menkes. In Menkes, you are not able to absorb copper. Your body is not getting enough copper. In Wilson's, it's just the opposite. Too much of copper. Okay, copper toxicity. Usually it happens like if you are eating on a daily basis and cooking as well on a daily basis in copper vessels, okay, or even drinking water, whatever water you drink, how much ever water you drink, if that you drink only from copper vessels and all, okay, Wilson's disease can happen. Okay. And also, if you're storing food in curries and all, especially cooked curries, you are storing in copper vessel, in the same copper vessel which you used for cooking, in the same vessel, if you are storing it, okay, copper ions can leak into the food, okay, and it can cause toxicity. So excessive salivation, stomach pain, nausea, vomiting, diarrhea, these things will happen. Avoid food that is stored in brass container as well. Brass, that is like, I guess, the 5 metal containers. Okay, looks very similar to have a gold tint. Okay, and also it can lead to liver failure. It's usually leads to liver failure because liver is trying to store this excessive copper. Okay, too much of copper in the blood, hypercarpemia. Okay, too much of copper in blood. Liver is trying to get rid of the copper from the blood. Kidneys are trying to get rid of copper ions from the blood. But in the same process, these copper ions get accumulated in the liver cells, in the kidney cells, and cause inflammation. Okay, so that leads to hepatomegaly, liver enlargement. Hepatomegaly means liver becomes big in size, swollen, enlarged, painful. Okay, jaundice, anything bad happens to the liver, always remember jaundice will affect. Okay, any metal, okay, except stainless steel, if you are storing food in any metal, those ions will leak out. Okay, acute hepatitis, then fulminant liver hepatic failure, a part of the liver, especially the portal vein area of the liver, they doesn't function. Portal hypertension. Okay, liver cirrhosis. These are the extreme cases. Liver cirrhosis, extreme cases. Okay, bones, it can cause arthritis, rickets, because even the bones and joints are trying to store excess copper. Okay, all the body parts, what they are doing is to get the copper out of blood. Okay, everyone in the body is trying to make this equilibrium by taking up as much as copper ions they can, but it will cause damage in long term. Okay, so arthritis, rickets, it will cause hemolysis. It will break your RBCs. Okay, it will break your red blood cells. It will affect your brain health. Okay, it can lead to mental retardation. Okay, not performing good in school, behavioral changes, uh, hand-eye coordination deteriorates. Okay, tremors. Tremors is that shaky feeling, the fingers and all. Dystonia, dysarthria. Dystonia, it's like uh, you're not able to use your sound properly, especially when it comes to children, young babies. All over the body, the muscle, it can go into contractions. Dysarthria. So here also the sound, it affects the speech, the voice, stammering, slurred, slow voice, that is dysarthria. Excessive salivation, mask-like faces, which means an expressionless faces. Because when the nerve endings in the face that control your expressions, those get damaged, you will have a stoic expression. Okay. Dysphagia, difficulty in swallowing. In your eyes, if you see a person who has Wilson's disease, if you see the rim of their eyes, okay, it will have that copper tint, terracotta copper tint. That is the Kaiser-Fischer's ring, we call it. That is copper ions, actual copper ions getting deposited in your iris, in the rim of your iris. Okay. Then cardiac uh, health deterioration, renal failure, these things will happen. So that's about inborn errors of metabolism. Is it clear to all?